Quite a grim picture if you are in Europe and you're living in nursing homes. Let's put this into perspective through the help of the gentleman who joined me at this part of the program. I'm going to have Max Chivoli to the left of your screens. He is our correspondent in Rome, also contributing to this show. I will also have Gearóid Ó Colmáin. He is a journalist and commentator who joins us out of the French capital of Paris. Gentlemen, it's good to have you with us. I'm going to begin with our correspondent in Rome. Of course, I'm sure you listened to the report of Said. How grim would you say the picture is?
Well, consider that the COVID-19 mortality rate in Italian care homes is much higher than the average national figure. And prosecutors are investigating scores of care home deaths. Consider that 600 care homes have been investigated so far across the nation, and in about 20% of the cases there were some irregularities in the way the centers were managed. Now, the probe is centered on the Pio Albergo Trivulzio, the care home in Milan, which Sahed mentioned. 143 residents have died there since the start of the virus emergency, and the director of the center is suspected of culpable negligence. Now, also the number of nurses who died so far with the coronavirus is 31, and over 30% of the dead nurses worked in residential care homes. So this is another important figure. Italian tax police has seized documents in the offices of the Lombardy regional government. Lombardy is one of the regions most affected by the coronavirus crisis, and many care homes in Lombardy are now under scrutiny. The finance police said that they were looking for directives from the regional governor of these homes, and now the Pio Albergo Trivulzio is really under scrutiny for having mismanaged the crisis.
Of course, that situation, like you said, needs due investigations to be done in Italy. I wonder if that's the case elsewhere in Europe. That is the question of Gearóid Colmáin in Paris. Do you think that is the case in Paris or in France? Or who do we basically blame for this? Of course, nobody is happy with the situation.
Well, the reality of the situation is that if you are admitted into hospital, you are tested for COVID-19. The testing itself is extremely unreliable. There are many false positives. Nobody really knows what it is yet because the virus has not been isolated. Secondly, most of the top medical experts in Europe, I'm talking about the head of the German Medical Association, the former head of the European Parliamentary Committee on Health, Dr. Vodark, say that this has been greatly exaggerated, that what we're dealing with here is essentially a coronavirus, another coronavirus. Coronaviruses have been around since the 1960s, and that pretty much every flu season in Germany, you have 25 to 30, sometimes 1,000 people dying from flu, but mostly people who are quite elderly. Now, in this case, you have a situation where 98% of people who get this flu virus, this coronavirus, survive. And so it is not life-threatening for most people in the population. The people who are most affected by this crisis are elderly people. But many of the top specialists in Europe that I've consulted have said that what is causing the mass casualties now is the crisis created by the lockdown. It is not the coronavirus itself. There could have been a very simple solution to wiping out the pandemic in France if they had used hydroxychloroquine, which was promoted and suggested by the top specialist in the country, Didier Holt. That was ignored because of a conflict of interest with the people around the Bill and Melinda Gates Foundation, who have now essentially taken over the World Health Organization and are pushing a vaccine agenda as a solution to this. Now, as I say, the good news is that 98% of people who get coronavirus recover from it. But it is being used now to essentially impose a global police state. We're under house arrest. We're being told that that could be a prolonged situation. We're being told that we'll need to be tested in order to travel again. So our right to travel, our right to freedom of assembly has been taken away from us. And all of the top medical experts, it's very important for the public to know that all of the top medical experts in Europe have been ignored here. There's a small group of people who are in the pay of the big pharmaceutical companies who are involved in managing this crisis, and it has been a fiasco from the very start.
Mm-hmm. Okay, let's just go back to Italy once again and ask Max another question about perhaps, what is it that the Italian government, of course, you mentioned investigation going on as far as the situation of the elderly in particular is concerned. But the question right now is, people want to see improvement in the situation of the Italian people and the country as a whole. Do you think that is happening at this time?
Well, let me just reply to my colleague that the Italian Statistical Agency announced just a few minutes ago that the number of deaths, I'm reading the piece of news right now,
sure,
the number of deaths in Italy between 2015 and 2019 has had an increase of 20% between March 1st and April 4 this year. So it was 20% higher, the number of deaths, compared to the years between 2015 and 2019. Well, I don't know. I might agree with what is said about the COVID-19 crisis and how it has been handled, but the situation remains critical. I don't know exactly what's the extent of the crisis. You might be right when he said that the whole situation has been pumped up. But anyway, what are people expecting? People are expecting to get back to a normal life, to conducting a normal life, and unfortunately, it seems that the situation remains pretty unclear. In the rest of Italy, there will be a gradual recovery. Some shops have reopened, but in some regions the situation is very much different. In Lombardy region and in the northern part of the Emilia-Romagna, shops are still closed. It is very much unclear what's going to happen. Let's say that the lockdown will stay on at least until May the 3rd.
Mm-hmm. Okay, May the 3rd, that is. Thank you. Let's ask a final question from Gearóid in Paris. And how do you think the situation is going to turn out? Of course, let me just mention that the previous question I asked Gearóid would look specifically at the situation of the elderly in elderly homes. But anyway, you addressed it in a general picture. I thank you for that. But what do you think is going to happen? Regardless if you're elderly, because that has to do with management of the pandemic. I mean, like that falls within the management of the pandemic as a whole. How do you think this is going to turn out for the French people and for the elderly?
Well, I think that the fear damages people's health, and we have had a disgracefully fear-driven propaganda campaign led by the mainstream media. Lots of fake news, lots of misinformation. Pretty much everybody who dies now, it's COVID-19. There's no accountability whatsoever. Old people are sitting in nursing homes watching this on the television, thinking that they could have it every time they cough, every time they sneeze. It's absolutely ridiculous. They have no concern whatsoever for old people. They would be happy to see most of them die because they don't want to pay social services anymore in Europe. The social system is basically collapsing, and the elites in charge would like to see most of them die off very quickly. And they're doing a very good job right now with the lockdown, because the lockdown is crashing the entire global economy, the entire population essentially under house arrest, and old people sitting in nursing homes watching this rubbish on television, this mass media disinformation campaign. There really is nothing to fear. We should have more accountable public services, more accountable politicians essentially in Europe are not listening to medical experts. The Swedish, for example, model was far more sensible. In Sweden, they listened to the state epidemiologist. He said that it was not necessary to have a lockdown, and Sweden is still a functioning country. France is now becoming a basket case, and I don't think it will survive this crisis because the economic impact and the social impact is going to be absolutely catastrophic. But again, I would like to reiterate, the reason for the catastrophe is not the coronavirus. The reason for the catastrophe is the political decision to put the entire population under house arrest and to scare the hell out of old people and then abandon them to their deaths in nursing homes.
Thank you. That's an interesting aspect. I'd like to appreciate time with both of you gentlemen, Max Ghibelli, a correspondent in Rome, of course, and Gearóid Ó Colmáin, journalist and commentator out of Paris. Thank you very, very much. I really appreciate your viewers watching the show as well. Thank you.